Hi guys. Today is the prenatal class. This video is going to be for the prenatal breastfeeding class. And I think I'd mentioned in one of my videos that today I would talk about, my next video would be about getting started breastfeeding. So if you're pregnant and you're not sure if you're going to breastfeed, you're not sure if you want to breastfeed, or you have questions about breastfeeding, or you know you want to breastfeed, but there are things you would like to learn a little bit more about it. You might even have questions regarding what I'm going to talk about, and be sure to comment below or send me an email or something like that, and I will be sure to answer any of those questions. So I thought we would start. Typically, when in a class, they would talk about the anatomy of the breast. They would talk about, let's see, um, positions, how you would hold the baby, what to expect during your pregnancy, questions that some moms have about breast changes, um, and pumping before the baby's born. Sorry, excuse my hair and my face. I noticed my face looks really swollen today. I'm not sure why. Anyway, so I thought I would talk about a couple of things today because I posted one of the videos and it was like 30 minutes long, and I had posted it in like increments, so I didn't realize it was going to be 31 minutes. So today I thought, I want to try to keep them 15 minutes or under, because anything longer than that and it's going to lose your attention. So I thought that the topics that I'm going to choose today are just a few of what you would learn in the getting started breastfeeding. But since it's really going to kind of be like an ongoing class, I'm going to try to talk about just a few things in one video and then save more for another video. But if you have a question that you need answered more quickly, like I said, feel free to comment below or email me. So I want to start with the anatomy of the breast, and I want to just start with like what changes to expect in the breast, and then also a couple concerns that mom have about their breasts and what can happen when you're pregnant and when you're breastfeeding, some myths that are out there. So I kind of thought I'd talk about that. And since I will be talking about the breast, I will also touch on a proper latch. And I will show you some pictures that I have of a proper latch and what it should look like, as well as, trying to explain it to you. So I'm going to start with a few questions / myths that people have, and a lot of these questions would come to me when I would teach a class, and I kind of like want to hit those right away so that you kind of have that answer if you're questioning, especially if you're not sure if you want to breastfeed due to some of these myths that you heard. So I'm going to start with the size of your breast. Whether a mom is a double F or she is an A, she still can breastfeed. It does not determine your milk supply. The baby determines your milk supply, and then how often you breastfeed in those first few days determines how much milk your breast can carry. Because in those first few days where the milk has not, they like to say the milk hasn't come in yet, but it hasn't increased, I want to say, or changed consistency yet. It's still colostrum. How often the baby feeds from the breast during that first 2, 3, 4, 5 days. That's when receptors, hormones are laid, and it's receptors where the hormones attach to. So the more receptors that are laid in the breast, the more milk. You can think of it like milk banks. The more receptors, the more milk that those banks are going to be able to hold. So it does not matter what size breast you are. In fact, your breast will get bigger because you're pregnant, whether you breastfeed or not, they are going to, get bigger during pregnancy. And you will every mother will go through the milk coming in and the breast being full and engorgement and all those things. So whether you choose to breastfeed or not, you're going to experience your breasts getting larger. You're going to experience the engorgement and the pain of the milk in there until the milk dries up. So that is one myth, is that if you have small breasts, that you won't make enough milk, or if you have extremely large breasts, it's going to be hard for the baby to breastfeed. And then some people think because I have large breasts, I'll have plenty of milk or I'll have too much milk. And if I don't plan to breastfeed, what's going to happen? Things like that. So size of the breast does not matter. Also, does breastfeeding cause the breast to sag? Actually, what causes breasts to sag is old age. It's as we get old, and the elasticity in our skin, it's gone. So if we have good genes where you have family, that pretty much you guys, the skin stays smooth, not a lot of wrinkles, they age very well, they don't have a lot of sagging in the face and the skin, then that is a good chance that you won't experience the breasts maybe sagging as quickly. But the sagging of the breast does not come from breastfeeding. It only comes from being pregnant and the breasts enlarging, and how often you get pregnant can also determine the elasticity and if your breast will sag when you're older. So if you have, maybe smaller breasts and you were pregnant a lot and you breastfed a lot, you don't have to worry that you're a mom who breastfed. Let's just put it this way. A mom who gets pregnant 4 times but never breastfeeds, and a mother who is pregnant 4 times and breastfeeds every one of them, their breasts will still sag the same whether they breastfed or not, depending on the genes in the family, depending on your elasticity in your skin, depending on your breast shape. Sometimes the breast is shaped a little bit different, and I will kind of show you that when I show you this picture of the breast. And the way that it shapes and where the nipple is on the breast can determine like how it looks as far as like sagging goes. But age is what brings on sagging, and being pregnant brings on sagging. It is not breastfeeding. And I'm going to say an 80-year-old woman who never had children and another 80-year-old woman who had children and maybe breastfed or didn't breastfeed can still both have the same saggy breasts, because it really comes from old age. And when you're pregnant, your breasts get bigger, so that elasticity is pulled. But really, old age is old age, and we're going to sag eventually. So whether we sag or not is not dependent on breastfeeding. So that is another myth that I want to mention about the breast. Another myth that is, said a lot, this is more about latching. They say that it's painful when a baby breastfeeds. But when a baby is on the breast feeding, it should not be painful. If it's painful, then the baby's not latched correctly. Now, there are some women that have more sensitivity in their nipple area, and maybe their breasts are just more sensitive. If you find that just even with regular day-to-day life that your breasts tend to be, on a tender side, if they're knocked, it's painful, the nipples are painful, you might experience a little bit of discomfort in the beginning when you first start breastfeeding, just because it's natural for you already to be tender in those areas. Now, it would be even more important that the baby latches correctly to avoid damage done to the nipple. So latch is really, really important. But mainly if there is pain, the baby's not latched correctly. And also sometimes, let's say it's your first baby, you might experience a little bit of chappedness or a little bit of discomfort at first, and then that goes away. But it should not be to a point where like you're cringing or you're screaming or you're grabbing hold of something because you can't handle the pain. It should not be that way. So that means that the baby is not latched correctly if that is how it feels. And you do not want to pull the baby off just because it hurts. You have to break the suction and get and then take the baby off. Do not pull your nipple out of the baby's mouth, because the baby's going to be sucking. And then when you pull that, it's sort of like they say when a dog bites or a cat bites you, you shouldn't pull away because that causes the tearing in the skin. A lot of times if you just, keep your hand in their mouth and say no, and I'm not talking about a dog that's attacking you, but versus, like puppies and so forth, pulling your hand away causes more damage. So when the baby is on the breast, you do not want to pull the baby off when it's painful. You want to break it quickly and get the nipple out of their mouth, but you do not want to pull the nipple out or pull the baby off. So that's, something to mention. Those are some myths that I can think of at this point in time. So, making sure the baby is latched correctly. There should be no pain. And biting, which is something that I'll probably talk about in another video. Let me see how long I've been on. 11 minutes. Okay. So, that typically when they're eating, they cannot bite because their tongue comes out over their bottom teeth. So they're not really biting. They can't bite. So that's a little bit, I'll talk more about that in another video. So I'm just going to kind of like show you my iPad picture and see if the camera will show it. Okay, so basically the area that looks sort of like grapes, that is where your milk is stored. And that's where the receptors, it matters where receptors are laid all around, but those are your actual ducts for the milk to be held in. The darker skin around the nipple, that's called your areola. And then, you'll see a lot of, if you look online, you'll see these areas back here they look like clusters of grapes. Those are all areas where your breast holds milk. And your nipple itself can have more than one opening. So, it's not necessarily just one opening. So there is sort of the idea of the breast. Kind of understand a little bit the anatomy. You got your nipple, the skin around it is the areola. Right under the areola are your, let me see what they call them technically, your milk ducts, milk ducts and milk glands. So the actual round part is the gland and the ducts are where the milk is released to. Hormones are what release that milk. So that's why it's so important to breastfeed as much as possible, because it tells your hormones, kind of gets your hormones so that they're releasing correctly. I'm going to post these pictures at the bottom because I want you to be able to see them. All right, then here are proper proper latches. Up here you see the baby's mouth is open wide. This is bad latches, when he's only got the tip of the nipple in his mouth. He cannot suck correctly, nor he has to be able to pull the nipple to the back of his mouth, and that is not painful when he pulls it from the areola area. Again, I will post at the bottom. And then I'm going to post some holds, but I think I will actually do another video just talking about the different positions, and then also feeding cues, what a baby looks like. So I'm going to kind of leave it at that. Also, the stomach sizes of a baby. I'm going to also talk about that in a video. I'm going to leave this video pretty much it. So that's just talking about the breast anatomy, and then I'm going to start the next video.